Welcome everyone to today's webinar. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We're looking forward to hearing your questions. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. Please be patient as the post-webinar preparation of materials can take some time. It is now my pleasure to introduce today's presenters. Our first presenter, Mary Kilmer, is an Executive Director of Healthcare at Oracle. Mary is an industry strategic expert with 40 years of experience as a clinician, hospital executive, and strategic consultant directing Oracle's healthcare industry point of view for 10+ years. Mike Andrus is Vice President of HCM Transformation at Oracle. Mike partners with key customer executives to share HR transformation and technology strategies, leading practices, and research while serving as an internal advisor to Oracle's sales, marketing, and product strategy teams. Prior to joining Oracle in 2016, Mike spent 10 years leading HR operations at one of the nation's largest health systems, as well as 10 years in progressive finance roles at a global telecom company. In his roles on senior leadership teams across 2 different industries undergoing major transformation, Mike knows what it means to be the face of change within large organizations and leading initiatives with executive stakeholders. At this time, I am pleased to turn the floor over to Mary to begin today's presentation.
Thank you so much, Ayla, and good morning or good afternoon to all of you, and thank you for joining us. It's such a pleasure to be able to talk to all of you and about a topic that's passionate for both Mike and I. We know that you're healthcare experts, and we're not here to lecture you about what's happening in the industry, but sort of as a context for the topic that we're going to talk about, it's important just to point out all of the changes and the issues associated with the healthcare market as it exists at the moment. Lots of challenges, lots of issues that we haven't had to deal with before. As was referenced initially, you know, my background is 40 years in the industry as a consultant and at being at Oracle actually for 18 years. But I also am the privilege of being on the board of directors of our user group, which is close to 5,000 members. And they talk to me on a daily basis with emails. So I understand what's keeping them up at night and probably what's keeping you up at night. There's a lot of things that organizations want to accomplish, but the traditional way of doing them isn't really working for many of them. Part of it is the roles that we've all played in the past as C-levels within hospitals, and part of it is the technology that enables these new roles to occur. And so we're going to talk a little bit about both and what we're seeing in the industry from a success factor. But sort of this busy slide sort of represents the frantic pace of change within the industry, from the talent crisis to really focusing around cost and even global expansion. We're working with a number of customers that are already have or building hospitals across the world, taking the data and really enabling it going forward and looking at the disruptive or innovative, pick a topic or pick an adjective, new technologies, and how are they incorporated in, and what are the use cases associated with it. It is almost dizzying to think about, and also exciting at the same time to think about what these new technologies and other new technologies can do to help us improve our patient quality, cost, service, outcomes. We also have new entrants into the marketplace. You probably all have been approached at some point by Amazon or one of the others that are here, who are really looking to disrupt how we deliver care and how we think about the delivery of care. From using our smartphones to order nurses for the ICU with someone that called in, as opposed to having to pick up the phone and arrange it. Of having payers be more engaged on the provider side and providing direct service, of having these large corporations like Berkshire and others saying, we're going to step in and try to think of a different paradigm, a different way of doing this to improve how healthcare is delivered. And then, of course, what we've been dealing with for healthcare reform, managing more risk, looking at population health from cohort management, really thinking about the data associated with how we're delivering care, the cost of delivering care, and looking at the precision medicine aspects of it. So lots of great changes, lots of confusing changes, and lots of changes in how we relate to each other, and as well as the technology, as I said before. Next slide. So if we think about the, sort of pulling this out and thinking about those new drivers, the concept of the complicated payment methodologies has really driven to even more complicated organizations. In order to manage risk, you all are expanding and growing and creating mergers and acquisitions, or maybe even divesting, to help manage that risk and help look at population health. We're working with a number of organizations who are really changing and restructuring their entire operating models from how they operated even just a year or even 6 months ago, of looking at how to manage this how complicated and sophisticated organization to consume those new technologies and be able to reach new types of outcomes. More focused on community care, obviously outside the hospital walls, but also changing priorities of looking at consumerism and looking at the experience, not just from a patient or a physician or community experience, but what about the caregiver or the employee experience? How do we look at how we project ourselves as an organization by what we offer our employees to be able to utilize, whether it's when they try to apply for a job, all the way through it when they're doing their business. And also growth. All of this complicated and spurred on by where we started with the High-Tech Act, and then to the Affordable Care Act, and then moving to MACRA and other types of reform. But the exciting thing is, being a clinician at heart, I get passionate about saying, this is good. We're really changing the way we're doing without saying this is the way we've always done it. And maybe this is what we needed to have done to make us rethink how we do things. Next slide. And also these new entrants in the marketplace, they're also spurring us on to say, why can't we do this? Why shouldn't we be able to do this? Why can't we be able to use blockchain to improve our implant processes? Why can't we use the web more to be able to do more diagnostics? Apple is certainly bringing us along. Others are bringing us along to be able to say, we don't have to be tied to what we did before. But what does that all mean? So how does that change what we do as a healthcare marketplace or organization? How do we adopt and adapt to these new issues, and how do we work together to be able to be successful associated with it? It is about transformation, but it's also about doing it in a way that makes sense, not just for the sake of transformation. It's not just about new paradigms, but it's about making sense with new paradigms to help improve the relationships that we have internally within the organization, whether that's at the C-level, internally with our employees, and also externally with our patients, community members, and also physicians as well. So with that, Mike, I'm going to turn it to you to explore the topic even more.
Great, thanks, Mary. Yeah, and in addition to the new drivers that are impacting the industry and the convergence around technology and care delivery models, an additional backdrop that's challenging healthcare today is just the competition for caregivers, because ultimately it comes down to patient experience and who they're interacting with on a day-to-day basis. And so these are just some highlights. If we start to drill down into some of these numbers, it again just kind of paints that picture of the environment we're all operating within today. So you've probably seen the headlines of the unemployment rate at 3.9% nationally. If you remember back to your economics classes in college, that basically translates to full employment from an economist standpoint. When we start to look at BLS numbers, start to drill down beneath that a bit, we see an even tighter labor market as it relates to healthcare. So the industry as a whole is standing at 2.4% unemployment, so almost half the national average. And when you drill down specifically into the hospital subsector, you can see that drop down to even half of that, so 1.1% unemployment. So it is absolutely a job seeker market. where caregivers can be very selective in terms of evaluating where their next place of work will be. The other thing we're seeing is just turnover in leadership. Some of this is a result of what Mary articulated in terms of some of the trends that are happening in the market. But beyond the fact that almost a fifth of hospital CEOs have turned over last year, that number has also been steady at 18% for 4 years running. So all the way back through 2014. In 2013, that number was 20%. So at some point, we've got to look at this and say this isn't a blip on the radar, that this is kind of the, not to sound cliche, but kind of the new normal around hospital leadership. And again, I think that's a direct correlation to organizations understanding how do they fit within their communities, how are they leveraging technology, and do they have the right leadership teams in place. A further complicating matter around that CEO turnover is typically CEOs don't leave on their own, right? There's usually a reach back, and they're bringing maybe a COO or a CFO with them. And so we see kind of that trickle down beyond the chief executive and the other C-suite leaders within these systems. Now, as we talk about getting and finding this competition for caregivers and getting them onboarded, we're also in kind of an uphill battle, right? Nearly 25% of caregivers are turning over within their first year. And when we drill down beneath that number and we look at some of the more critical roles within a health organization, like a CNA as an example, they're up over 30%. But also when we start to stratify this, not just based on first year turnover, but even expanding and looking at turnover over 2 years, we see those averages creep up over 30%. So the ability to find is just the beginning. It's how do we really retain, get onboarded, and make those first couple of years sticky for new employees. And then finally, just demographics working against us as well, with nearly half of all registered nurses going to reach traditional retirement age here over the next 2 years. So we have that on top of shifting patient volumes, and you can see we're obviously living in a kind of a very volatile labor market right now. So related to that then is how does all of that impact patient experience? And as Mary mentioned, interacting with HR and finance leaders within healthcare, we're hearing more and more this idea of how do we connect the dots between the effectiveness of employee programs, things like leadership development, succession planning, establishing mentors early on in caregiver careers. So not just preceptors necessarily, but how do we create kind of ongoing relationships? How do we start to really think about career planning and career mapping, and what do next steps look like for younger workers that are looking for that next step in their career? Obviously, a lot of fluidity around staffing models, right? Shifts, overtime, working alongside agency nursing, all of that having an impact on the engagement level of employees. And then ultimately thinking about how are we sourcing and capturing new employees coming into our health systems. And we see that retention is significantly improved when employees are onboarded in an organization where they already know folks that are there, right? They've already got a pretty good idea of what the culture is like and an understanding of the work environment. That tends to drive higher retention in those first couple of critical years. So partners like Gallup, Press Ganey, those that are administering some of these employee engagement surveys have started to draw these correlations between patient safety and employee engagement, as well as patient experience through HCAHPS. And you can see some of the significant swings between top half, bottom half, top quartile, bottom quartile organizations, which is again kind of driving the need and the necessity for leaders to really start digging into what's effectively driving engagement within their organizations. Now, as the title of the webinar suggests, we're here to talk as well about the partnership between HR and finance. And so against the backdrop that we talked about, we're going to spend a little bit of time just looking at CHRO top priorities as well as finance leader top priorities. And again, that backdrop obviously is a challenge of bringing new strategies and new practices, streamlined practices to organizations to make sure we've got agile business functions that can respond to the market changes, as well as a workforce that's ready to meet those needs. In our actions with HR and finance leaders, we hear many of the same top priorities. In particular, from an HR perspective, right? It's about creating employee relations environments that are promoting improved patient safety and patient experiences. And again, looking at how do we really address clinician burnout, which is starting to drive and erode some of that engagement. It's also driving turnover as we get into a nearly fully employed labor market. Closely related to that is just the analytics then to link some of that employee performance and engagement with those patient experiences. Another area is looking at leadership models and talent pipelines to align with these rapidly changing and expanding organization structures. And related to that then, once we've got these leadership models and the talent pipelines identified and succession plans, is how do we apply that to some of the workforce planning that's going to model the effects of shifting case mix and new service lines on the staffing needs. So getting down to a skill level as an organization looks at maybe shifting focus or shifting strategy more around telehealth. What does that do to the skill mix of the caregivers that are employed? And do they have the right skills, and start plotting that out in terms of how do they start to map and close those skill gaps. In my 2 years with Oracle as well, I've been probably in front of 50 plus health systems and talked with HR leaders. Nearly, I'd say 8 out of 10 are engaged or planning some level of merger, acquisition, or affiliation with another organization. And so the ability to be agile, to onboard new organizations more quickly, more streamlined, and get those new organizations integrated, not just in the systems, but in the culture of the organization is a key driver, a top priority as well. And then finally, Mary mentioned disruptors. So we were in front of a health system not long ago and asking about what are major disruptors in their local market. And a hand in the back of the room went up that said compliance reporting was a major disruptor. So while we talk about new entrants and we talk about convergence and we talk about what's impacting the industry, one of the main disruptors in just the day-to-day operations in the health system is largely around gathering data, making sure it's clean, streamlining that, and providing that in the right format for compliance reporting. So if we move on to the CFO top priorities, again, how are we aligning within the industry, and how are CFOs prioritizing? A lot of this being driven by cost reduction, and how do we make leaders within the organization accountable? How do we get the right amount of information, the right amount of detail to our leaders to make informed decisions? Right? There's a happy balance between raw data, too much information, and too high level information that's available in dashboards and a lot of enterprise intelligence systems today. So how do we strike the balance of getting the right amount of detail to our decision makers? If we move down from that, right, data cleanliness, consistent and trusted data. What is the source of truth within the organization? And more specifically, are we measuring cost accurately within our health systems? If we move down, just developing models for prioritizing demands for raising and allocating capital, such as technology innovation. Again, we've heard from finance leaders that have shifted funds from patient towers and capital allocation projects over to creating command centers for telehealth. And we heard that health systems are building innovation centers that are supporting venture capital investing. So starting to participate in that innovation component that's driving the industry. So at the risk of stereotyping finance versus HR, I think we can make the case that even considering that there are effective leadership teams who meet and collaborate frequently, many times decisions made with or by the CEO in consultation with the CEO or CHRO are happening separate from one another. Meaning a lot of times decisions are made, HR may not be in the room, finance might not be in the room. And as a result of that, information that's being provided into those decisions are often provided through the lens of the CFO or the CHRO. So finance information, if we kind of move down this slide, tends to be very profit focused, a focus on profitability, focus on cost control, very data driven, with a focus on business results. On the CHRO side of the house, HR info is typically more people focused versus profit focused. HR is often viewed as a cost center, as overhead, versus kind of the strategic business partner that it's aspired to become for so many years. Decisions tend to be culture driven, a focus on culture, and focused on employee performance, employee results, and employee engagement. And so obviously the goal here when pulling together this idea of collaboration between the CFO, the CHRO, and the CEO is this shift from focusing profit versus people to more collaborative between profit and people. And these don't necessarily need to be mutually exclusive. When we look at the systems that are supporting finance and HR today, another way to look at this through these lenses is kind of the historical roles of the systems that are managed by finance and HR. Financial systems are typically focused on the what, right? What's happening, what trends are we identifying within the business. HR is then often tasked with kind of executing and reacting to those findings or reacting to the trend analysis. And then the response is having those right people with the right skills in the right place at the right time. So the opportunity really that we're bringing together today is to move this model forward is really having actionable insights, having the common data model, having the ability to do analysis, both current state, but look in real time, but also being able to move into more predictive models of the why and the how things are happening within our organization. And then combining that perspective of the CHRO and CFO and our HR and finance data. So Mary, do you want to share with us here kind of moving forward how this partnership looks and some of these examples around the business processes that deliver these actionable insights?
Yes, thank you. That was great, Mike. Thanks. So we know that the roles are changing, everything we just articulated. And we know that individuals want to do what's best for the organization, but sometimes traditional roles get in the way of that. Next slide. So it's really about being a team sport, as I referenced, not to be trite, but it is about working together and really taking a look at the organization's mission and values and creating strategies that make sense for pushing the organization together. And it isn't about the traditional, this is the money person and this is the people person. They have to be correlated together. Now, of course, there needs to be technology that supports that, but we'll get to that in a second. But the planning component isn't just maybe we should acquire another hospital or build a new building or create a new innovation center. It's also about what are the new care models that support that and what types of individuals from a skill set perspective need to be able to support that as well. And does it make sense? Currently, does it make sense right now in this marketplace to be adding new people when maybe there's a shortage of employees, even though it might be a great opportunity? The synergy associated with workforce planning is really, we're seeing quite a bit of interest associated with it around taking technology and actually doing that planning going forward. not just, the traditional how many FTEs or worked hours or productivity measures, but incorporating that in the strategic budgeting, planning, and modeling process. Adding to that the ability to be able to do decisions based on algorithms using machine learning. So bringing some of those algorithms over and using those disruptive or innovative technologies to say, what if? What if we did this? What if we built this building? What if we tried to improve or add or enhance our cardiology services that we offer? What kinds of implications would that be from a financial perspective, as well as from a human resource and caregiver perspective as well? How do we engage our community from, a physician, whether they're employed or whether they're staff physicians or whether they're community physicians? How does that all fit into what we do? All the aspects need to be there. So therefore, everyone needs to be on board from a C-level, and it absolutely is essential that the CHRO and the CFO are working hand in hand to be able to accomplish that. Next slide. So when you're looking at the outcomes associated with this new operating model, and when we talk about new operating model, it's interesting. The terminology that Mike and I are seeing are ones that we wouldn't necessarily have thought about for healthcare just a few years ago. The concept of agility. How quickly can the organization move and transform itself to adapt to new entrants, to new challenges, to new payment methodologies? How quickly can the organization adapt to, the changes in the employment market, and how do we get the right skill set? So if we look at care costing managing, you look at the cost of care and how you get down to that individual patient level. Obviously, there are employee or human resource costs associated with those resources, but there's also other types of costs. And the idea is that you don't just look at one bucket. You have to look at it across the entire organization of what's all of the aspects associated with contributing to that cost across the continuum. And not just the inpatient side. Obviously, we're talking about outpatient and ambulatory care and even telehealth. What is the cost associated with that? And how do we work together to determine that? What about the productivity measures associated with it that look at the post-cost reductions? You have to have a technology to be able to marry those together. And you have to have a technology that brings in the clinical data with the operational data, with the financial data, with the HR data to really truly understand not just how is the organization doing as an aggregate, but how is each individual entity in these new sophisticated and complicated healthcare systems that we've all created to be able to do. Someone was just asking me this morning, actually, I'm at a hospital, and they said, well, how many multi-entity organizations are working with you? And I said, well, how many of them are multi-entity? And I said, all of them. It used to be an integrated delivery network definition, and I guess I'm dating myself, was a hospital plus something else. Now I really don't know of any hospital that isn't plus something. Even a community access hospital probably owns a physician practice or a home health agency or something. So we're all in this new venues of the new world that we're in. And how do you figure out what you're going to fund and what's the bottom line associated with it? And how do you determine what are those productivity measures that make sense? And then going forward from this new innovative technology, disruptive, it's really exciting to be able to take a look at the impact, not just from a productivity perspective, but if a nurse can pick up her phone and say, Siri or Alexa, sign into Oracle and deliver me a box of checks, what kind of caregiver experience is improved, as well as what kind of productivity and cost reductions is improved, is significant. So those transformative technologies are not just something that would be interesting to do. They can really change the game, not only on the bottom line and the margin, but also on the experience of those as well. So in order to foster all of this, there needs to be technology that supports and gets away from this concept of silo. The silo of the finance, or the silo of AP or budgeting and planning is totally separate, which is totally separate from decision support, which is totally separate from the clinicians as well. We can't function, or we can't be successful, or we can't embrace these new paradigms, without those walls coming down and really working together. And in order to be supportive of that, you need technology to be able to bring that on board. When I say technology, I'm talking about the HR systems and your finance systems and your materials management systems and your business intelligence systems as well. They can't have silos either. They have to all correlate and orchestrate all of that data and all of that information in a real-time basis, not just, from a budget perspective, who's closed their books today or who's finished their budget, but actually across the entire organization, so you can slice and dice and look at each entity and then make your planning associated with what makes sense going forward, both from a human resource perspective as well as from a financial perspective as well. So the CFO and the CHRO have to work hand in hand. They are as equally important to the success of the organization as each other are individually. They have to be successful together, and they have to look at how do we orchestrate in harmony all of this information back and forth between HR, not just from a prosaic, we need to look at succession planning, or we need to reduce our turnover rates, or we need to close our budgets quickly, but what is the implication for each one of those functions, and how do you work together in order to do that? Mike?
Hey, thanks, Mary. So let's shift over to the cloud. Specifically, what are we looking at in terms of how does Oracle identify value? What are we hearing from our customers in terms of the value by moving finance and HR together on a common cloud platform? When we look at finance and HR business processes, we've identified at least 34 touch points that otherwise have to be managed separately when these processes sit in disparate systems. In addition to that, this underlying platform that Mary talked about, things like social collaboration, predictive analytics, AI-enhanced experiences like chatbot and recommendations, all of that takes longer to roll out and integrate when your ERP and your HR, supply chain, BI systems are spread across multiple systems. So when we talk to customers about what underlying value of bringing this all together on a single cloud platform, 4 key themes really surface. First is this user experience. The single user experience can help reduce training costs, right? Everybody's operating within the same intuitive interface users are used to using, like on their mobile phone or on a tablet. And they're utilizing those underlying platform capabilities, things like social collab, AI analytics. So there isn't this need for teams to pull data together from all these different systems and do all the data mapping, all the cleanup, all the translation tables, and then loading it out into another system for reporting capabilities. So all of that's improving the productivity and the collaboration even between HR and finance functions. Another theme that pops up is around this single provider. By consolidating with one provider, it's relieving IT and IS teams of all that duplicative maintenance, as well as interfacing systems. And so by being on a single maintenance and upgrade cycle, working with a single vendor, it's simplifying ownership and ultimately reducing cost of ownership. So let's drill down a little bit on the other 2 themes that pop up, the one data model and universal reporting and analytics. So if we think about a single data model, it ultimately translates into streamlined finance and HR operation processes. So again, as I mentioned earlier, no more data mapping or translation tables. The data is sitting in a single system and it's available to both sides if you think about this binary between ERP and HCM or financials and HR. But ultimately, one of the core drivers of value is around the role definition. So where an employee sits within the organization, drawing that organizational hierarchy, it drives approvals globally within the system. It enables role-based reporting. So having access that's filtered correctly for that particular end user based on their role, whether they're HR, whether they're finance, whether they're a manager, and obviously they're an employee. They could be pieces of all four. But the component there is that it's a single security model that's driving all of that role-based access. You've got easier visibility as a segregation of duties. So you've got basically consolidated governance between your systems that you can easily see who has access to what information. And then finally, just this idea of having clean data in control with a single global employee definition, meaning you're not importing or creating contractor records or ghost records in your financial system, or the number of users in your HR system aren't correlating to the employee population that you may have in there because you're managing security separately or disjointed between your different platforms. So the other theme that pops up in terms of the value of being in a unified cloud platform is this idea of having enterprise-wide data that's driving this unified reporting and analytics. So having direct real-time access to your data. So not running nightly interfaces, weekly batch jobs, massaging data, doing data mapping, worried about how many records are falling off your interface files, how many new hires didn't make it out of the recruiting system into your core HR system, and how long will it take for any of those that happen to be managers to be able to approve expense reports for their employees. So all of that basically gets significantly streamlined. Also, just the ability of having HCM data and finance data in a single view. Pre-configuring ahead of time these easily customizable reports and analytics, meaning these dashboards don't necessarily have to be one size fits all. So it's that theme back that we talked about with the CFO and CHRO around giving the right amount of data to our leaders to be able to make informed decisions without overwhelming them with a lot of unnecessary data. So calling their attention to the things that need action versus providing a lot of static information that typically gets ignored over time. And then finally, being able to bring enterprise data that's bringing true business insights to your organization. By that meaning the ability to bring third-party data in. So to start looking at the correlation between patient experience or HCAP scores in departments, drawing correlations between employee performance within a department and whether that's a leading or lagging indicator of patient experience. Being able to see profitability by department and tying that together as well with employee performance data. So you can see with some of these examples how powerful having this unified reporting and analytics platform can really be. And these aren't just Oracle customers that are telling us as well. So last year, MIT Technology Review surveyed, I believe it was over 700 HR and finance leaders and asked them, these are all leaders that had moved HR and finance systems to the cloud, and asked them how that went. So did it come out better than expected, in line with expectations, or worse than they expected? And what we can see here, just to highlight a few of the big takeaways, is nearly half of those that responded said their ability to meet senior management information requirements actually resulted better than expected by moving these two things together versus doing them in piecemeal. We talked about new lines or new service lines and mergers and acquisitions, and you can see here as well, nearly half felt that their agility to respond to market opportunities and challenges, even changes within their organization, were better than expected. The quality of decision making improved, nearly half reporting better than expected. And if we jump down to the bottom there, the actual cost of transitioning to the cloud coming in for just over a third of respondents as better than expected as well. So making this move of HR and finance together doesn't necessarily have to be a daunting cost decision as well. So another organization that we partnered with is Aberdeen Group. They provide industry research and consulting. And last year we shared findings from their survey as well of over 200 leaders that had integrated HCM and ERP in the cloud. And you can see some of the results that came back from that survey. Most significantly, we talked about regulatory and compliance reporting being a disruptor, and you can see that nearly half of those that moved to HCM and ERP were able to monitor regulatory compliance more easily. And then finally, just hearing from our own customers, right? And so these are real life examples of results from organizations that have moved their HCM and financials together to the cloud. And you can see some of the results here in terms of processing variable comp, improvements in recruiter productivity, the ability to complete employee reviews significantly faster. If you look at most organizations taking 3 or 4 months in that review process, so the relative improvement there being 30 to 50% faster, and seeing significant cost takeouts as well. As Mary mentioned earlier, even the ability to close month end faster, right, and getting streamlining and accelerating the budgeting process. So with that, we'll turn it back over to Mary for kind of summarizing our discussion here this afternoon.
Actually, Mike, can you go back to the slide prior to that? Your slide that you had a second ago. I just wanted to add a couple of things to this. So wherever you are on this, in this journey, the transformation journey, whether you're still trying to, do the basic blocking and tackling, or whether you are looking at global transformation and world domination, you still need to take a look at the technology that supports your mission and goals, and that supports your C-levels, your CFO and your CHRO working together. And if that technology is siloed, and is supportive of individuals only focused on their own area, then you can't achieve whatever goals you are trying to achieve. You need to look at a technology that allows you and frees you up to do the jobs that you want, that you don't have to constantly be writing SQL queries to find the data that you want, that you have a technology that orchestrates that information from the beginning, because it is a holistic solution. It's one platform that starts with HR and includes supply chain and materials and procurement and budgeting and planning and costing and account reconciliation and GL and AP and all the rest. It includes all of it. So information is applied in one place and then is distributed throughout. Information is updated in one report and it's included in all reports. So you can focus on what you're trying to accomplish. But we're getting away from that whole concept of build, building your own reports, building your own applications, and focusing more on what you're trying to accomplish and really improving the quality of care for the community that you serve. And getting away also from the customization of, let's take a piece of software and then let's change it so that it mirrors what we've done always in the past, when you're trying to change and do something different and adapt and adopt going forward. So next slide. So in this webinar that we've tried to cover 2 areas, both focused on how finance and HR can work more effectively together and working more effectively together from a cultural perspective, as well as the technology that serves it. So it goes without saying that, if you're in those functions and if you're in those roles, don't feel you have to stay in your traditional lane. Doesn't mean that you have to be in everyone else's jobs, but you have to look at the viewpoint and the perspective of the others from finance and HR and back and forth. You have to respect each other's point of view, that each individual contributes to the value associated with the mission and vision you're trying to accomplish. with one governance approach. You have to speak with one governance approach, with one voice to the organization to really effectively affect your change management. You also have to think about governance from a technology perspective. You can't, traditionally it's been okay to go out and buy pieces and parts of equipment or pieces and parts of solutions. So that it is on an everyday basis. I talk to CIOs and CHROs and CFOs who tell me they have 7 or 8 different pieces of software that support their materials management or procurement system. They have 22 HR systems because there was one little niche thing they wanted to add. Well, all of that level of complexity takes away from your ability to be able to look downstream and say, where do we need to go? It takes away from your ability to be able to assimilate your acquisitions and your mergers and your transformation. So think about the one voice and the one governance. Take a look at holistic solutions that can support that from a cloud technology, and allow this piece of cloud technology that you would embrace then to provide to you this ability to take a look at your entire organization, across it, slice it, dice it, make decisions, empower you with new algorithms for more effective decision making, and allow you to be able to take a look at from a workforce productivity perspective, from succession planning, from every aspect of the things that you do. Take a look at your strategic vision, and not just about, will the revenue be there, but do you have the talent to be able to accomplish it? And if you don't, how do you get it? And how do you attract it? And how do you bring them on board? And how do you keep them once they're there in this market that we've just talked about? As well as robust analytics and data visualization. It's not just about having a fancy dashboard with a pretty pie chart, but how do you truly correlate and orchestrate that information, not just from an HR or materials or finance perspective, but also from your clinical perspective as well. You need to look at organizations that partner together from clinical, as well as can bring that data in, and not just do the traditional hours per patient day or, FTEs per effective patient days. Really, what are the new metrics going forward, and how do we manage those that incorporate things like Mike had mentioned, HCAP scores and Press-Ganey scores and other types of satisfaction scores? What about that population health? What about those cohort management, the socioeconomic aspects associated with those? All of those new types of measurements and demographics that we have to take a look at with this new healthcare systems that we're creating. So with that, we appreciate your time, and we are going to open it up. So Ayla, if you might mind going and asking for questions, we'll see if there's any questions from the audience.
Well, thank you, Mary and Mike, for that fantastic presentation. Like Mary said, we will now begin today's question and answer session. So please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. And we'll try to get through as many questions as we have time for today. We've already had several questions come in, so I'll go ahead and get started with the first one. And this question is for Mary or Mike, and it is, how many healthcare organizations currently have these capabilities that you were discussing throughout the presentation?
How many? I'm not sure what the question is really. Are you asking how many organizations that Oracle works with that has adopted these types of technologies? If from an aggregate perspective, there are over 200 organizations across North America, not even including global, that are working with us with a part of the cloud technology. Some of them have a particular solution. Some of them have a full suite of solutions. But we're also seeing on the other side, from a cultural perspective, just about every organization that we work with, whether it's a small community provider or a large academic provider, IDN, or a payer for that matter, we're in every instance that I can think of, and I'm sure, Mike, you would agree, there's change going on. There's some sort of transformation that's happening. So they are trying to change the way that they manage their technology, and they change the way that they're managing their relationships. Mike?
Yeah, I would agree, Mary. And I think tying back to looking at finance and HR together, moving on to a common platform, I would assume you would agree as well. We're seeing more and more customer evaluations that aren't just looking at changing out an HR or a financials or supply chain or BI. We're starting to see what we call multi-pillar RFPs or evaluations looking at vendors. And so I would say, from my perspective, I've only been on this side of the fence, so to speak, for 2 years. But in the 2 years I've been here, I've seen the percentage of evaluations that include both HR and finance together increasing as a percentage of total evaluations.
I'd agree. I've been around longer than the 2 years, but absolutely, it's been significant. And frankly, it makes us happy because we know that that's the right approach. We know that it's better together, that orchestration from soup to nuts, from the time an employee is recruited and hired all the way through every business process that they'd be using. Having that single platform, that single approach, that single set of security and analytics, all orchestrated together, is what's of value. So we're excited to see it.
And I would also add that just looking at some of these third-party research firms like the MIT Technology Review and Aberdeen that we cited, obviously Deloitte, KPMG, Accenture, EY, they're all out evaluating what's happening in the industry. And I would expect that we'll also be able to measure more and more respondents to these types of research studies that they're doing. So I think the Aberdeen, we had about 200 respondents. If they were to do that survey even 2018, I imagine we would see that number significantly higher.
Let me just add one more thing. We're talking about relationships and partnerships and collaboration internally within healthcare organizations. I would say that what we're also seeing is that from a healthcare organization and a vendor relationship, that partnership has become even more important, especially with cloud, because at the cloud, you're connected 24/7. So picking a partner, a strategic partner that you feel has your back, that is going to be with you for the long haul, and is there to collaborate with you, is important as well.
Thank you, Mary and Mike, for your insight there. Really appreciate your responses. We've had a few more questions come in, so we'll go ahead and move on to the next one. And this person wants to know, what does Oracle call the specific products that address this, i.e., what are the product names?
What are the product names that we've been discussing? Is that the question? Well, you're not going to answer that.
Yeah, I think they're just wanting to know the solutions, the specific names of the solutions that you were discussing, if that's available.
Sure. Of course. Well, obviously, we're talking about, enterprise resource planning. And, in the healthcare industry, we all know that includes just about everything. So from a financial cloud perspective, from a supply chain, which includes materials management and procurement, also self-service procurement, we have warehouse management and demand management to be able to be more effective as far as demand planning. We also have enterprise performance management, which includes budgeting and planning. We have a micro costing solution to look down at the patient care costing. We have account reconciliation, which is significantly important these days with all the different entities that are brought into a complicated organization to really reconcile all of those different accounts. We're seeing that a lot of interest, especially with M&A right now, as well as other budgeting and planning solutions. And then on the HR side, I'm going to turn it over to you, Mike, for that.
Yes, on the HR side, generally known as HCM Cloud, it is comprised of various modules. The important thing to note, though, is that all of those modules with our current release of R18 is all built on a common platform. So our former applicant tracking system that is probably familiar to a lot of people as Taleo was always recognized as a standalone. That has been completely rebuilt onto the unified HCM platform. So this idea of integration, and there's kind of this talk between integration and unification, right? Which is the right word. Integration historically has suggested some kind of an interface between systems. What we call integrated cloud now is really modules that are built on the same core data model, residing in a common database, so that it alleviates the need for passing data between the various components. And that runs the entire span within the HR or HCM, Human Capital Management platform. That runs the entire span of sourcing, applicant tracking, onboarding, back through all of your core HR employee processes like manager and employee self-service, position management, all of the talent management processes, so performance goals, succession, learning management system, the LMS, all the way back through to reporting capabilities as well. Again, all built on the same platform without that need to send data back and forth.
So everything we've just talked about is Oracle Cloud. And sometimes, we confuse the market by using the term Fusion. It's the same thing. It's Oracle Cloud, Oracle ERP Cloud, Oracle Financial Cloud, Oracle Supply Chain Cloud, Oracle Enterprise Performance Management, and Oracle HCM Cloud. Hopefully that answers that question.
Yes, great. Thank you so much, Mike and Mary, for that clarification there. And it looks like we have time for about one more question. And the final question is, what do you see as a trend or leading practice for organizations to start with HCM or ERP first?
Wow, that's a loaded question with 2.5 minutes to go. We probably have different perspectives. So, Mike, I'm going to let you take it first, and then I'll take it real quick, and then we'll end it up.
Well, I think it actually probably touches on exactly what you're highlighting, Mary, and that is that every organization is kind of in a different place, right? I think our approach is we want to accelerate time to value. So if that time to value is that you've got more disparate HR systems out there that are costing you a lot of money and resources to maintain and keep connected, maybe that's the right place to start. On the flip side of that, if you're looking at the ability to leverage some new emerging technology around supply chain or materials management, and that's your biggest opportunity for cost takeout. If that's a driver within your organization, then maybe that's the right place to go. So I don't know that there's a one-size-fits-all necessarily for every organization in terms of which one to start with. I don't know, Mary, you may have more perspective on that.
I totally agree with you. It's where the pain is, where you need to focus on, what you think is the burning platform, if you will. There are some schools of thought that, you should create at least your employee structure for approvals first, so that even when you get into supply chain, you've got that established. There are other schools of thought where there is no burning platform that redoing your GL makes sense for the start of, taking a look at creating a more modern GL, a more thinner GL than it's been in the past. And that should start first. But it's really an individual decision based on your organizations and what's the need and the pain, as I said before.
Well, thank you both for your responses there. And that was all the time that we have today. So this concludes today's program. I do want to thank Mary Tomer and Mike Andrus for their excellent presentation, and thank our audience for participating. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.